I think that in a political environment that we're in right now, it's actually just a tremendous glimmer of hope that people can have in seeing that there are areas in which we can agree. And PBMs are a perfect example in which everyday Americans who live in rural areas, who live in urban areas, working people are getting totally squeezed by essentially this middleman where their costs are being totally driven up, that their prescription prices are being totally driven up. And for once, we have Republicans who are championing this legislation and tackling lowering these costs, Democrats who are on board with this. And I can tell you, should this legislation come to the floor, this Republican majority has my vote. You have my vote on this, and you have the vote of many Democrats on this. Now, we've had this for some time, as what has been mentioned. Last Congress, Republicans and Democrats worked together to draft bipartisan legislation on PBMs. And one provision that made it into the December 17th, 2024 continuing resolution demonstrated how we can work together to rein in PBMs and lower drug costs for patients. We've seen how this can work, and this is a bipartisan measure that can propose more oversight of the PBM marketplace. Dr. Fiedler, can you explain how greater oversight can, in this circumstance, can help lower costs for everyday Americans?
So I think the most promising change from my perspective is the proposals to expand transparency, which I think would help PBM's clients get a better deal from PBMs. You know, this is probably most important for employers, and my view is that over the long run, employers would pass some of those savings along as wages, lower premiums, or better benefits.
And we've seen this at work even, you know, with hospital provisions forcing a little bit more transparency. We've seen costs go down when there's actual disclosure around what is going into these prices. Now, this bill was almost passed on December 17th within a bigger package to prevent the government shutting down. It has all of our support. For folks following at home, Democrats supported it, Republicans supported it. So why isn't this moving? It's not because there's no substance for it. All four witnesses testifying today are in support of it. Republicans are in support, Democrats are in support. So what happened? Well, on December 17th at 4:15 in the morning, Elon Musk began firing off a barrage of social media posts opposing pharmacy benefit manager reform, PBM reform. And all of a sudden, this bill that had almost unanimous support fell apart in a matter of hours. And the vote was postponed on that day. After he tweets, it gets canceled. Elon Musk tweets, we have nearly 435 members of Congress all on board of it. He sends one tweet, and all of a sudden, everyone backs off. And it kills drug pricing reform that saves people money on their insulin, on their asthma inhalers, on everything that they need. And then, to kick it off, 5 days after he kills pharmacy benefit manager reform, we get this tweet from Elon Musk. What is a pharmacy benefit manager? This was at 1:02 a.m. on December 31st of 2024, 5 days or so, a couple days after he kills the bill. So the problem here is not a substance issue. It's not a process issue. It's an oligarchy issue. It's a power issue. And this room is where the power of the people of the United States reside. Whether you're a Democrat or you're a Republican, everyone here was elected to be accountable to the people of the United States, not to be governed by tweet, but to be governed by their duly elected representation. And so we can get this done because there are more of us than there are of him. So I would love a commitment from our Republican counterparts who we agree with on this issue to just put it on the floor and let us vote for it where there is bipartisan agreement and we can actually get a result of for the American people by booting this guy out from political influence. And with that, I yield back.